Iranon District Hospital presents the semi-annual performance review, spearheaded by our supportive Chief of Hospital, Dr. Harris D. MACAPEGES. As we reflect on our progress, it's important to remember our guiding principles. Our vision at IDH is to be the leading hospital of choice and be recognized as the center of excellence and leadership in quality healthcare services for all, especially in MDN and nearby provinces. Driven by this vision, our mission is dedicated on providing affordable yet efficient and high-quality healthcare services, ensuring well-being of the Iranon community and beyond. Our foundation is rooted in a strong legal basis, an act creating and establishing Iranon District Hospital in the municipality of Parang, province of Maguindanao del Norte, and an act introduced by MPs Obaida C. Pacasim, Suharto S. Esmael, Matarule M. Estino, Abdullah B. Hashemi N. Dalanggalin, and Marjani S. Makasalong, an act converting the Iranon District Hospital into a provincial hospital to be known as Iranon Provincial Hospital and appropriating funds therefore. This legislation underscores our commitment to serving the healthcare needs of our community. This structure clearly includes the legal basis, providing context, and emphasizing the hospital's legitimacy and foundational principles. Iranon District Hospital is staffed by a dedicated team of 132 personnel, comprising 63 clinical staff and 69 non-clinical staff members. The hospital operates as an infirmary with an active delivery room, providing essential healthcare services to an estimated population of 364,002, with 25 authorized bed and 45 implementing beds. The facility ensures adequate capacity to meet patient needs. IDH holds multiple accreditations and memberships, including PHIC accreditation, Consulta accreditation, and recognition as an NBS facility. Additionally, it is licensed by the DOH and is a member of the PHA, underscoring its commitment to maintaining high standards in healthcare provision. Iranon District Hospital offers a comprehensive range of services to meet the diverse healthcare needs of the community. These includes outpatient department services, emergency room services, laboratory services, pharmacy prescription, family planning services, newborn screening services, ultrasound, dietary services, delivery room services, operating room for minor cases, Adolescent Youth Development Program, and Delivery Room. Iranon District Hospital offers various services beyond medical treatment. Their ambulance call and transport services ensure swift patient transfers in emergencies. The Social Worker Services or the B-Cares program provides essential support to vulnerable individuals. Through the MAIPP or the Medical Assistance for Indigent Patients program and AMBAG, the Ayunbag Medical mula sa Bangsamoro Government Financial Aid is available for those in need. Additionally, the hospital supports patients with PhilHealth Consulta for comprehensive health care, and they offer specialized care through the Mental and Psychosocial Support and Women and Children Protection Unit. Iranon District Hospital, led by Dr. Harris D. MACAPEGES, who serves as the Chief of Hospital 2, overseeing all aspects of the institution's operations. Supporting him is Reham Dimaren, RN Man, the Chief Nurse, responsible for nursing services and patient care. Dr. Nurhaina Sinarimbo, as the Chief of Clinics, manages the clinical services and ensures the quality medical care provided. The administrative functions are handled by Catalino O, Molina Jr., RN Man, the Administrative Officer 5, who ensures smooth administrative processes and supports the hospital's overall management. Iranon District Hospital has maintained a consistent number of authorized beds over the past few years. In 2022, the hospital had 25 authorized beds. This number remained unchanged in 2023, with the hospital continuing to operate with 25 beds. By the mid-year of 2024, the authorized bed count still stood at 25. Despite the rising bed occupancy rate, the hospital has managed to provide care with the same number of authorized beds. In 2022, Iranon District Hospital operated with 35 implementing beds to meet patient needs. The following year, in 2023, the hospital increased its capacity to 45 implementing beds, reflecting efforts to accommodate a growing patient load. By the mid-year of 2024, the hospital continued to maintain 45 implementing beds, sustaining this expanded capacity. Iranon District Hospital received a total of 1,570 admissions in 2022. This figure increased dramatically in 2023 with 2,154 admissions recorded for the year. By the middle of 2024, the hospital had admitted 1,441 patients, demonstrating an ongoing growth trend. Given this tendency, the hospital projects more admissions by the end of 2024. This constant growth in admissions reflects the increased need for the healthcare services in the community. In 2022, Iranon District Hospital did not receive any inpatient transferred from other facilities for inpatient care. This changed in 2023 when the hospital accepted 25 transferred patients, indicating a growing recognition of its capabilities. By mid-year 2024, the number of transfers had already increased to 28, suggesting a continuing upward trend. This rise in patient transfers reflects the hospital's expanding role as a critical care provider in the region. As transfers continue to grow, the hospital remains committed to adapting and enhancing its resources to meet the increasing demand. In 2022, Iranon District Hospital transferred a total of 57 inpatients to other facilities for specialized care. This number increased to 70 in 2023, reflecting a growing need for services beyond the hospital's capacity. By mid-year 2024, 43 patients had already been transferred, indicating a continuing trend. Based on this trajectory, the hospital expects the total number of transfers to be higher by the end of 2024. This trend underscores the importance of strong inter-facility collaboration to ensure patients receive the necessary care. The hospital's outpatient department served 2,957 patients in 2022, reflecting steady community engagement. In 2023, this number increased significantly to 4,166, indicating improved outreach and services. By mid-2024, the OPD had already served 6,180 patients, showcasing a substantial rise in demand for outpatient services. The trend suggests a doubling of the patient count by the end of the year, highlighting the hospital's growing capacity and effectiveness. This impressive growth underscores the institution's commitment to expanding access to quality healthcare. In IDH, the total number of emergency department visits increased from 962 in 2022 to 2,223 in 2023, indicating a significant rise in patient visits. This surge reflects a growing demand for emergency medical services and possibly an expansion of the facility's capabilities or outreach. By mid-2024, the number of visits further increased to 2,621, showing a continued upward trend. This consistent growth highlights the growing reliance on emergency care and potentially signals an increase in either patient populations or service utilization. The trend underscores the need for ongoing adaptation and resource allocation to meet the escalating demands of the emergency department. In IDH, the total number of patients transported from the emergency department to other health facilities has shown a positive upward trend, reflecting the facility's capability to manage complex cases effectively. In 2022, 91 patients were transferred, and this number increased to 193 in 2023, indicating improved coordination and referral processes. By mid-2024, the number of transfers rose significantly to 495, demonstrating the facility's growing role in providing specialized care and facilitating patient needs beyond its immediate resources. This increase signifies that IDH is successfully addressing more complex and severe cases with a strong network of referral partners. Overall, these trends highlights the facility's commitment to delivering high-quality care and optimizing patient outcomes through strategic transfers. For the mid-year of 2024, Iranon District Hospital has recorded the top 10 morbidity cases affecting the community. Leading the list is pediatric community-acquired pneumonia with 422 cases. Acute gastroenteritis with moderate dehydration follows, reflecting the ongoing challenges in managing gastrointestinal health, recording 285 cases. Urinary tract infections have impacted 183 individuals, while dengue fever with warning signs has been diagnosed in 159 patients. Pneumonia with measles has affected 49 people, and hypertension stage 2 has been identified in 42 cases. The hospital has also treated 19 cases of acute gastritis and 18 cases of pulmonary tuberculosis. Both typhoid fever and benign febrile conditions have been observed in 8 patients each. Diabetes mellitus type 2 with 6 cases, rounding up the top 10 morbidities for the period. In the mid-year of 2024, Iranon District Hospital has identified the top 10 leading OPD consultations. Urinary tract infections topped the list with 500 cases, followed closely by pediatric community-acquired pneumonia with 490 consultations. Acute gastroenteritis with moderate dehydration accounted for 187 visits, while hypertension stage 2 was seen in 124 patients. Dengue fever with warning signs was diagnosed in 108 cases, and diabetes mellitus stage 2 had 86 consultations. Lower respiratory tract infections resulted in 60 visits, while parental consultations totaled 30. Pneumonia with measles and sebaceous cyst both had 19 cases each, rounding out the top 10 consultations for this period. Iranon District Hospital recorded 1. Mortality in the mid-year of 2024. The cause of death was pediatric community-acquired pneumonia, classified as high risk. The patient also suffered from electrolyte imbalance secondary to age, which led to severe dehydration. Additionally, the patient experienced septic shock, contributing to the fatal outcome. This highlights the critical need for timely and effective medical intervention in such complex cases. In 2022, there were no urinalysis tests conducted at IDH. By 2023, the number of urinalysis tests surged to 3,592. As of mid-2024, the count has already reached 4,059. This significant increase indicates a growing demand for urinalysis at the facility. The trend suggests that the total for 2024 will surpass previous years significantly. In 2022, IDH have no records of any fecalysis tests. By 2023, the number of fecalysis tests performed rose to 798. As of mid-2024, 788 tests have already been conducted. This trend points to consistent demand for fecalysis at the facility. It is expected that the total number of fecalysis tests for 2024 will be higher by the end of the year. In 2022, IDH conducted 1,548 hematology tests. The following year, in 2023, this number increased to 2,282. By mid-2024, the number of hematology tests had surged dramatically to 6,067. This substantial raise indicates a growing demand for hematology services at IDH. The current trend suggests that the total number of hematology tests for 2024 will be significantly higher by the year's end. In the field of clinical chemistry within IDH, 2022 saw 91 notable developments and advancements, reflecting a period of growth and innovation. The year 2023, however, experienced a hiatus with no new significant contributions or progress reported. This pause was unexpected, creating a gap in the anticipated advancements. By mid-2024, the field rebounded remarkably, with 2,458 new developing markings, a dramatic resurgence. This resurgence highlights the dynamic and rapidly evolving nature of clinical chemistry in IDH, showcasing a renewed focus on innovation and improvement. In IDH, the field of immunology, serology, and HIV saw substantial activity in 2022, with 203 significant developments and advancements. The momentum continued into 2023 with a notable increase to 437 advancements, reflecting a period of significant progress and innovation. By mid-2024, the field experienced a remarkable surge, reaching 836 new developments. This dramatic rise underscores the ongoing expansion and deepening of research in these critical areas. The rapid advancements highlights the growing importance and focus on immunology, serology, and HIV within IDH, driving forward new discoveries and improvements in patient care. In 2022, the hospital performed 962 X-rays and referred 321 patients for external imaging services. However, in 2023, no X-rays were performed on-site, leading to 1,085 referrals. By mid-2024, the situation remained unchanged with 0 X-rays performed and 570 patients referred. The hospital anticipates a significant increase in on-site X-ray services with the completion of the new building. This development aims to reduce referrals and enhance diagnostic capabilities within the facility. In 2022, the hospital performed 691 ultrasound procedures and referred 128 patients for external services. In 2023, the number of performed ultrasounds decreased to 530 with 278 patients referred. By the mid of 2024, this trend continued with only 357 ultrasounds performed and 478 patients referred. However, the hospital expects to increase the percentage of performed ultrasounds by the end of 2024. This anticipated improvement aims to enhance in-house diagnostic capabilities and reduce the reliance on external referrals. The Iranon District Hospital has experienced fluctuating trends in medical assistance over the past 3 years. Ambag's support saw a substantial increase from 1,105 cases in 2022 to 3,824 in 2023 before decreasing to 2,279 in 2024. MAIPP also showed an upward trend, assisting 2,520 patients in 2022 and peaking at 3,261 in 2023, but then significantly dropping to 491 in 2024. B-Cares of MSSD began providing assistance in 2023 with 353 cases, slightly declining to 268 in 2024. Similarly, PHIC's point of service started operations in 2023, helping 645 patients with small increase to 700 in 2024, while Ambag and MAIPP both saw their highest numbers in 2023. MAIPP experienced a sharper decline in 2024. B-Cares and PHIC, though starting later, have shown a relatively stable presence. Overall, 2023 was a peak year for medical assistance in the district, followed by varying degrees of decline in 2024 across most programs. Iranon District Hospital has seen a significant increase in number of surgical operations over recent years. In 2022, the hospital conducted 122 surgical procedures. This number surged to 1,588 operations in 2023, reflecting a substantial rise in surgical activity. By mid-2024, the hospital had already performed 2,091 surgical operations, indicating continued growth and demand for surgical services. This trend underscores the hospital's expanding capacity and increasing healthcare needs of the community. Iranon District Hospital's pharmacy has served a growing number of patients each year. In 2022, the pharmacy provided medications to 530 inpatients and 1,288 outpatients. This number increased significantly in 2023 with 2,154 inpatients and 2,623 outpatients receiving pharmaceutical care. By mid-2024, the pharmacy had already served 1,535 inpatients and 3,934 outpatients. These figures illustrates the hospital's expanding role in meeting the pharmaceutical needs of its community. Iranon District Hospital has been actively monitoring various health conditions through its surveillance program. In 2023, there are 4 cases of adverse events following immunization or the AEFI and 6 cases of severe acute respiratory infection or the SARI. Measles cases increased from 79 in 2023 to 118 in 2024, highlighting a rising concern. There were 4 instances of 4 paralytic shellfish poisoning in 2023. COVID-19 antigen positive cases were 4 in 2022, rose to 21 in 2023, and dropped to 0 in 2024, indicating a significant improvement in controlling the virus. Iranon District Hospital surveillance data reveals significant trends in various diseases. In 2023, there were 6 cases of acute blood diarrhea and 2 cases of bacterial meningitis, with 1 meningitis case reported in 2024. Dengue cases saw a substantial rise from 230 in 2023 to 540 in 2024. Diphtheria cases doubled from 2 in 2023 to 4 in 2024, while hand, foot, and mouth diseases cases decreased from 4 in 2023 to 2 in 2024. Influenza cases spiked from 5 in 2022 to 352 in 2023, then slightly declined to 258 in 2024. Typhoid and paratyphoid fever cases increased from 1 in 2022 to 22 in 2023 and further to 40 in 2024. Rotavirus cases peaked at 238 in 2023 before dropping to 138 in 2024. Presenting to you are the following accomplishments of Iranon District Hospital for the mid-year of 2024, starting with the full implementation of manual op procedures per unit. Second, IDH has served beyond its bed capacity with its 25-bed capacity operation. IDH has served with an average of 40 to 50 as its maximum operational inpatient capacity. Third, health team supports during disaster and medical mission. Fourth, enhanced digitalization of records for easy access of all departments. Fifth, organize and train the disaster management team. Sixth, has extended its capability. IDH through our COH2, which is the surgeon, is the in-demand surgical unit requested by medical mission conducted by different stakeholders and has delivered numerous quality service to the community. Next, recognition by the national agency. IDH has been significantly recognized with its best practice of being the catchment area for the notifiable diseases like measles, diphtheria, dengue, and etc. 8. Approved Level 2 laboratory. The RLED has recently approved the LTO of the IDH, which complies for the Level 2. Additionally, tie-up initiative. With a limited capacity and funding, IDH has found ways and initiatives to cope with the growing demands of providing medical service to the public. Next is the construction of new storage. The logistical capability of the IDH is at a challenge, hence the construction for a new storage facility was made possible. Also, IDH is an active health education and promotional officer. Daily conduct of health updates to patients and hospital personality. To add up, IDH organized a mental health and psychosocial support services team to deliver services to the victims of flash flood at Matanog, Maguindano del Norte, and other affected municipalities. Also, IDH participated various conduct of medical mission both in Maguindano del Norte and Maguindano del Sur. IDH is one of the presenter during the program implementation review for the year 2023 in the hospital sector. Next is IDH is one of the participants in the workshop on revisiting the primary care provider network in the local government forum for universal healthcare in the province of Maguindano del Norte. IDH also acts as a team leader in the establishment of the Incident Management Team or IMT and EOC during the Palarong Panlalawigan 2024 held at Parang, Maguindano del Norte. Planning session of all department heads for the AOP and PPMP for year 2025 is one of the accomplishment report of IDH. In addition, conduct monthly health programs in the facility that include health education and promotion to all clients. Both OPD and ward is one of the accomplishment. Next, groundbreaking ceremony of the new Iranon District Hospital building located at Sitio Budacan, Parang, Maguindanao del Norte. Adding to the list is IDH has started 24/7 operation of the delivery room. Also, IDH conducted basic life support emergency first aid training in different schools in Parang, Maguindanao del Norte. Also, IDH caters students on the job training from Notre Dame Siena College of Midwifery in other secondary schools. Good relationships and collaborations with different stakeholders is one of the accomplishment. Adding to the list is attended the meeting before the Committee on Health held at the House of Representatives, Nograles Hall, Batasan Hills, Quezon City for the passing of Bill number 1358 entitled An Act Upgrading the Iranon District Hospital into a secondary level hospital and increasing the bed capacity for general care services from 70 to 200, appropriating funds therefore and for other purposes. Also, IDH catered the visitation of the World Bank under the Health System Resilience Project, DOH Central Office, MOH and IPHO Maguindanao to the IDH for assessment and plan for future projects for the hospitals. Next, the visitation of Dr. Chidoro Herbosa, the Secretary of Department of Health, for the assessment and site visitation for the conduct of MORI in the province. Here are also some of the accomplishment of IDH. IDH received 72 square meter tent donated by UNICEF, conducted Ramadan Symposium, orientation for the BAC or the Beads and Awards Committee. IDH created a vaccination team for the conduct of MORI, augmented at Barangay Poblacion 2, Parang, Maguindanao del Norte. IDH celebrated its second founding anniversary. IDH established a social media outlet for the conduct of health education promotion on different health programs via Facebook Live. IDH receives medical assistance from different members of parliament. IDH has its own hospital hymn. IDH has now launched its new hospital logo. IDH conducted individual performance commitment review and performance evaluation of IDH performance for the first semester of 2024. IDH Nursing and Medical Unit initiated the conduct of case presentation of the top 10 morbidity cases catered in the facility for the creation of Clinical Practices Guidelines or the CPG. The HEMS team responded during emergency and disaster at Matanog, Maguindanao del Norte. The IDH Dietary Department is now Halal certified. IDH is now accredited as a Level 1 adolescent-friendly hospital facility. IDH constructed 2 strategic locations for a new septic tank. Also, IDH constructed Sharp Vault, constructed an extension room for the storage of medicines. Also, IDH attended different trainings, seminars, and workshops that enhance the capabilities of health personnel. Adding to the list is attended the second reading for BTA Parliament Bill number 246, an act converting the Iranon District Hospital in the municipality of Parang, province of Maguindanao del Norte into provincial hospital to be known as the Iranon Provincial Hospital and appropriating funds therefore. Also, construction of new guardhouse. The renovation of conference room is also the accomplishment. Construction of OPD waiting area, construction of breastfeeding room, signing of appointment for new hard plantilla position. And those are the different accomplishments of Iranon District Hospital. Establishing a catch-up plan for Iranon District Hospital involves several critical steps. Here's the structured approaches, namely, establish standard operation procedures based on Health Regulation Division or HRD and Department of Health or DOH standard and protocol. All procedures in the area are based on the standard procedures approved and recognized by the HRD and DOH. Policies and guidelines, which is included in the standard operation procedure, provide a clear and comprehensive set of rules and regulations governing the behavior and actions of all clinical personnel within the institution. This will serve as our framework for decision-making, setting expectations, and ensuring consistency in how we operate in this institution. hiring of additional permanent position and job orders. As a result of the growing population in our area, the demand for healthcare services also increases. Therefore, it is only necessary that the number of healthcare workers in our hospital shall be augmented. Trainings, workshop, seminars, orientation, and other activities that improve employees' capacity. Such activities will help healthcare workers the necessary skills, abilities, and knowledge which will directly translate to improving their job performance. Number 4. Will ensure enough supplies and equipment of IDH. It is one of the factors that determines the functionality of a hospital. But we, as a personnel of the IDH, maximizes our resources to provide proper medical treatment. Medical supplies and equipment is required in different clinical units so that complete health services can be provided to the patients, and thus the need to refer patients to other hospital is not necessary. As such, we are also looking forward to the MOH to provide us our need and fast-track our requests, considering that our resources are very limited. Lastly, partnership in different agencies, organization, and department. In terms of clinical services, through medical outreach program is one of the means to promote the services the IDH can provide. It is also one way to provide free services to communities, especially the indigenous, without the need in going to the hospital. With our Chief of Hospital, Dr. Harris D. MACAPEGES, we are willing to advance our services to different parts of BARM. Hospital Development Plan for the year 2025 to 2027. Iranon District Hospital needs a comprehensive development plan to ensure sustainable growth and improved patient services. A water treatment facility is essential for providing clean and safe water for medical procedures and sanitation. Proper medicine supply and storage buildings are critical to maintaining the efficacy and safety of medications. The powerhouse guarantees a stable electricity supply, vital for medical equipment and hospital operations. A motor pool ensures efficient patient transport and emergency response capabilities. Finally, waste disposal and laundry linen buildings are necessary for maintaining hygiene and preventing infections within the hospital environment. Iranon District Hospital needs additional road access to facilitate easy and efficient transportation for patients, staff, and supplies. A public health unit is essential for community health initiatives, preventive care, and education programs. A multi-purpose building can serve various functions, including meetings, trainings, and community outreach activity. An OPD building is necessary to handle the large number of patients who require diagnosis and treatment without overnight stays. A 25-bed capacity building ensures the hospital can accommodate patients needing extended care. These additions are crucial for improving overall healthcare delivery and accessibility in the region. Lastly, Iranon District Hospital needs doctors and nurses' quarters to provide convenient on-site housing for medical staff, ensuring they are readily available for emergencies and extended shifts. A staff house is essential for accommodating other hospital employees, promoting a stable and dedicated workforce. A cadaver holding facility is necessary for the respectful and secure handling of deceased patients before their transfer to families or funeral services. An animal bite center is crucial for providing timely and specialized care for victims of animal bites, including rabies prevention and treatment. These facilities enhance the hospital's ability to provide comprehensive care and support to both its patient and staff. Here are the 6 major thrusts of Iranon District Hospital. First, increasing the bed capacity from 25 to 200 beds will address the growing healthcare demand. Second, to support this expansion, 158 additional Pantilla positions will be created, ensuring adequate staffing levels. Third, the augmentation of the MOD fund is necessary to cover the increased operational costs associated with a 200-bed facility. Fourth, approval and provision of capital outlays are essential for infrastructure development and equipment procurement. Fifth, upgrading IDH's services capability from an infirmary to level 1 will enhance the quality and range of healthcare services provided. Sixth, acquiring complete medical equipment is crucial for delivering high-quality healthcare. These efforts will significantly improve patient care, operational efficiency, and overall service quality at IDH. Comprehensive planning, budget allocation, and stakeholder support are critical for successful implementation. The proposed changes will transform IDH into a more robust healthcare institution. To end this presentation, I want you to inculcate this into your mind and heart. Sa Iranon District Hospital, tunay kang iingatan.